This week on Healthy Living, a close look at cervical cancer and how it's being addressed in Africa. Is yawning contagious? And finally, what do you do to fall asleep when you have insomnia? Hello and welcome to Healthy Living. I'm Lina Rondou. It is the second leading cause of cancer death in women worldwide. On the show today, we will take a closer look at cervical cancer. According to the World Health Organization, cervical cancer will kill more than 443,000 people a year worldwide by 2030, nearly 90% of them in sub-Saharan Africa. Currently, more than 68,000 people in Africa are affected each year, with nearly 50,000 deaths a year. Cervical cancer is often caused by the human papillomavirus infection, which are largely sexually transmitted. To learn more about this disease, we spoke with Dr. Kiyali Ouattara, director of the international non-governmental organization JPIGO in Côte d'Ivoire. Dr. Kiyali Ouattara, thank you so much for joining us here on The Voice of America.
Thank you.
So we want to talk about cervical cancer. Would you explain to us what is cervical cancer and what causes it?
Yeah, cervical cancer is a cancer, I will say. Mm-hmm. That means that there is, we call it a tumor at the cervix of women. Mm-hmm. And that's caused by an infectious disease, which is called, the virus is called HPV. HPV infection is the cause of cervical cancer that occurs later on to the lady.
Yeah. Okay. So cervical cancer, how is it diagnosed and how soon can it be diagnosed in a woman?
Yeah, luckily the cervical cancer is quite preventable. So can be diagnosed very early by doing some of the interventions that are clearly defined and clearly known, like the pap smear, and what we call in our jargon VIA, visual inspection with acid acetic. That visual inspection allows you to see precancerous lesions on the cervix of the lady, okay, so that you can treat those precancerous lesions with the cryotherapy so that she is not exposed or she is no more at risk of having cervical cancer later in her life, like 10 years or 15 years later.
So the cryotherapy is performed at an early stage?
Yeah, the cryotherapy is performed as soon as we have this VIA, I mean visual inspection, mm-hmm, and that we find that the lady has precancerous lesions. The cryotherapy can be performed. Okay. But it also depends on the size of the lesion that have been seen, because there are other techniques called the LEAP. So those techniques are taking care of the larger lesions. Okay.
When the cancer is advanced, yeah, is it what is done then at that?
So when the cancer is advanced, it's a specialized business now.
Okay.
Yeah, because it's no more for the
prevention.
No more prevention. When there is a cancer that is diagnosed, it's we call it radiotherapy. We call it and also the surgery. Mm-hmm. Yeah, but this is highly specialized. It can be done by a general practitioner or a nurse or a midwife, whereas the prevention intervention can be done by the midwives, nurses, and general practitioners.
How much of a problem is cervical cancer in sub-Saharan Africa?
Cervical cancer in sub-Saharan Africa is a huge problem. I would say a public health issue, okay, in sub-Saharan Africa. And the big thing, the good thing, I would say, is it's quite preventable. And I work for JPIGO, and my company has supported the Côte d'Ivoire government, my country, to implement a program at large scale with the Ministry of Health of Côte d'Ivoire to put at scale the VIA, the Visual Inspection Program.
Okay.
And this was targeting mainly HIV positive women, because the philosophy behind that was, why treat someone with ARVs, HIV medications, prevent her from dying for HIV, and let her die from cervical cancer, when we know that HIV positive women are most at risk of acquiring cervical cancer than HIV negative women.
And that's because their immune system is compromised.
Exactly.
Okay.
Yeah.
Okay. So then, what do you see the priorities in addressing cervical cancer? Should it be focused on women that are HIV positive, or should it be focused in women in general, but prevention, for example?
Yeah, I wouldn't focus the prevention intervention on only HIV positive women. I will say all women at age of childbirth should benefit from prevention interventions. And we have both lines. For young girls aged 9 to 14, according to the country policies, they can benefit from immunization. There is quite an effective vaccine against HPV. So for those young girls, before first sex intercourse, it's preferable to provide with the vaccination to those young girls. For other ladies, it's preferable to seek for VIA, to look for precancerous lesions, and then treat those precancerous lesions to prevent them from developing a cancer later on in their life.
So there is hope when someone has cervical cancer if they are diagnosed early on?
There is hope, but I will encourage our countries and all women to have prevention attitude.
For your time.
Thank you, madam.
Health cancer diagnosis. Scientists of University College London are developing new technology to help doctors detect a deadly bowel cancer and polyps in their earliest stages and ensure the best chances of a patient's recovery. The system, called Odin Vision, uses a combination of artificial intelligence and space technology for diagnostic precision. VOA's Latika Hook has the story.
Bowel cancer is the world's third most common type of cancer, and the sooner it is detected, the better chance a patient has to recover. But a doctor performing a diagnostic colonoscopy does not always see everything shown on the screen, and smaller details often go undetected.
We miss about 1 in 5 polyps during colonoscopy, and for the second biggest cause of cancer-related death in the UK, that's a big deal.
Scientists say artificial intelligence can see the entire image. It never looks the wrong way, and it never gets distracted.
As the live video is being streamed, our system takes in that image frame by frame, processes it with what we call an artificial neural network, and tries to identify where those polyps are by looking at things like the patterns of in the images, the different coloration of the tissue.
That data is too big and too detailed to be sent via the internet. So instead, Auden Vision uses the communication between the Earth and satellites millions of miles away, where the AI is stored in a cloud and transmits the information back in real time to the doctors who are making a diagnosis. The development of the new technology is in early stages. If it proves successful, the cloud will be accessible to clinics and hospitals even in rural areas, ensuring that every patient gets the earliest and most accurate diagnosis.
AI is essentially putting us at the point where we can ensure quality of service. So we're in essence democratizing healthcare, because we can make sure that you get the best expert type of diagnostic function everywhere throughout our hospitals.
Auden Vision scientists hope their breakthrough program will save thousands of lives and help patients avoid radical procedures. Bowel cancer survivors hope the new diagnostic technology will be available soon.
Hopefully this piece of software will be introduced, and so that my family can get reassurance quicker that everything is all right or not with my own health.
Auden Vision is planning a clinical pilot study in the next 12 months and expects early versions of the technology to roll out in the next 2 years.
It is often an irresistible phenomenon. We see someone yawn and we yawn. Hence the question, is yawning contagious? According to a study published in the journal Current Biology, the reason it is difficult to stifle a yawn when someone is doing it near us is in the region of the brain responsible for motor function. British researchers found that the urge to yawn when we see someone else do it is a contagious yawn. This is due to a type of echo phenomenon, that is to say, an involuntary automatic imitation. For this study, researchers observed 36 adults who were asked to watch video clips of other people yawning. After measuring their brain activity, the results showed, among other things, that the participants could not help but yawn. In addition, the desire to yawn increased when they tried to resist. Insomnia, many of us have experienced it. Being in bed at night without being able to fall asleep is quite common. We wanted to know what you do to fall asleep in this case. This is what some of you in Lagos had to say.
Okay, what really makes me sleep? I hate movies, so I might just watch movies sometimes. Like most times, action movies. Sometimes it looks bored to me, so I might sleep. Or I might take pills, so I'm not going to lie. If I'm finding it out to sleep, then I'll take pills. But recently, the traffic of Lagos alone, when I get home, I just sleep off.
I take a glass of wine. When I take a glass of wine, before you know it, or before I hit the pillow, I'm already asleep. Because a glass of wine acts as a sedative. I cannot speak for other people, but for myself, it really helps. I don't take any other sedative or any drug to help me sleep.
But most of the times at night, if it's difficult for me to sleep, I may just read novels. From there I sleep off. Then at times too, I could wake up from the bed and go watch movies in the living room. From there I could sleep off. At times too, I can handle my phone, maybe browsing, looking at one thing or the other. I'll just sleep off. I think basically those are what I do to sleep.
The easiest for me will be stress. Stress, yes. You know, in this part of the world, particularly Nigeria, let me bring it down. We all multitask in one form, one way or the other. So once I begin to multitask, I fall deep into stress. And once I get stressed, the next thing is sleep. You don't want to know. Deep, deep sleep. So, for instance, I go play football, I go do sport. For instance, I attend family engagement. For instance, I attend to family issues. Once I step feet into my living room, I'm gone.
According to the National Institutes of Health of the United States, NIH, there are several factors that can help you sleep better, including your room. It must be dark, calm, and cool. Next, avoid caffeine, alcohol, and stressful situations near bedtime. Going to bed and getting up at the same time each day also helps. Finally, the electronics. Not at all advisable before going to bed. So computers or tablets, a cell phone, and even television are to be avoided in the bedroom. And that's our show for today. For more on today's topics or for your questions, visit voanews.com. You can also follow me on Twitter at @LenorMoudou. Until next time, stay well and strive to make every day a healthy day.